We wanted to work on this retrospective analysis because we feel that we need much more work for patients with relapsed and refractory T-cell lymphoma because we don't really have good treatment options for those patients. So we worked with our colleagues in various institutions around the US and Australia to try to identify patients who have been treated with Romidepsin and Azacitidine off clinical study. There is a very known phase 2 clinical study published in Blood that looked at specifically at oral azacitidine and Romidepsin in these patients. However, we realized that because of the rarity of this disease, there's only like 7,000 cases per year in the US. A lot of patients that were seen in clinics were not able to participate in very rare studies that are only available in select centers. On top of that, some patients had really poor performance status, which made them ineligible for the study. And also they had some secondary malignancies, which would also make them ineligible. And we were able to identify a total of 25 patients who were treated with this regimen in our institutions. It was pretty remarkable because we were giving intravenous or subcutaneous azacitidine because we were not having oral azacitidine, and up to a third of these patients had really poor performance status. When we collected the data, we realized that the overall response rate in these patients was 79%, which is truly remarkable. And what was also potentially quite important is that we realized that we could use this regimen as a sort of intermediary step to achieve remission for patients who are going for stem cell transplant. So 6 of these patients underwent allogeneic stem cell transplant, and all of them were in remission, and 1 underwent autologous stem cell transplant. The tolerability was quite favorable as well. There was some hematologic toxicity which prevented us to give certain doses of Romidepsin, so we had to dose reduce, but otherwise it was really well tolerated, like I mentioned, even in those patients who had poor performance status.